Hi, this is Matt Kempf, your SPEEA Benefits Director, and I'm here to talk about the offer that's in front of you for consideration, how it relates to medical and disability. This is a distribution of the SPEEA represented Profs and Techs and by which plan they and their families are enrolled in. The vast majority are in traditional medical plan. It does make the most sense for most people. There's a declining amount in Select Network, and you actually should have seen this chart before because this is published every year in the November Spotlight for open enrollment. It's important to realize that Boeing pays claims with cash on hand. That's a self-funded medical plan. So if every single employee got swine flu, then Boeing's stock price would go down because they would pay all of those hospitalizations with cash. If all of you got really healthy, then Boeing would save money because Boeing pays the claims with cash. That's one of the reasons why they have a non-smoking campus now. That's one of the reasons why they ask you today to do the health risk assessment and get that $50 gift card for you and your spouse. And that's what happens today. They want you to know that you have high cholesterol so you can address it before you become a heart attack and an expensive admission. Since the self-funded plans are being modified in this offer, they're losing grandfathered status under the Affordable Care Act, which is actually a good thing. Normally when you lose something, that's not good, but in this case, when you lose grandfathered status, that's a good thing. So there's changes and increases to the preventive care visits that are available, including all of the American Academy of Pediatric well baby visits. Naturopaths are also recognized providers in all the plans, and there's new protections for the worst case scenario. Getting right into it, this is the traditional medical plan as it is today and as it will remain through 2017 with the changes that are effective January 1, 2018 in this offer. And you can pause this presentation and take time to soak it up, but I'll go through the highlights. One of the biggest changes that you would notice out of your paycheck is that now the traditional medical plan will cost 5%. And there's a lot of confusion out there. It's not 5% of your pay. It's not 5% of your salary. It's 5% of the plan costs. The costs right now are about $575 a month or $580 a month times 1, 2, or 3, and you would pay 5% of that. I've got a slide in the back about how much that is expected to be going forward in 2018. The second change, that this is for all the locations. All the locations will have the exact same traditional medical plan, and Portland, Utah, and Palmdale will all pay 5%. Right now, Portland, Utah, and Palmdale are paying 12% for traditional. So this is a reduction in cost for them that can be, considerable. The deductible is changing from $225 to $300, a flat $300, and it's no longer based on your salary. Right now, there are over 13,000 people with salaries above $100,000. So right now, if your salary is above $100,000 and you're enrolled in the traditional medical plan, your deductible is actually higher than $225. Going forward, it's a flat $300, but it's still 3 deductibles per family, and there's a new out-of-network deductible. We would always encourage you to see in-network providers as much as possible because it will save you money. The out-of-pocket max is unchanged at $2,000, but now it includes your deductible. So it's really like a $300 deductible, $1,700 out-of-pocket max if you were to compare this with last or the current plan. There's a $500 additional family out-of-pocket max requirement before the plan pays 100%. And the largest change is that now the plan has a 10% coinsurance. So after your deductible is met, then you'll pay 10% of the bills. And that can vary based on what kind of provider that you see. If you go to physical therapy, maybe they bill $60 for a visit, you'll pay 10% of that after your deductible, which is $6, which is less than $15 that you're paying now. If you go to a brain surgeon, maybe they charge $300. 10% of that would be $30, which is more than you're paying now. So how much you pay when you use the service is going to change dramatically. If you were to go to the hospital, you would pay the first $300 as your deductible if you hadn't met that deductible already that calendar year, and then you'll pay 10% of the hospitalizations. So this will cost folks more if they end up going to the hospital, including emergency room. There's no copay. It's just a flat 10%. I'm sorry, it's a 10%, not a flat, but it's a 10% after your deductible. There's no change for the drugs filled at a retail pharmacy. The mail order drugs have a $10 more for brand name drugs, whether it's formulary or non. And then one of the protections that comes in because of the loss of grandfather status is there's a maximum out of pocket for prescriptions. Some people see this $4,000 and it's a big number, and so they get kind of worried. Today, your exposure for drugs is unlimited. Going forward in 2018, there's a maximum that you'll have to pay. So while this number is high, it is better than infinity, right? The medical plan select network, this one you're currently paying 12% if you're enrolled in this plan, and going forward it's also going to stay at 12%. Kind of like that drug out-of-pocket max, there's a new out-of-pocket max that protects you from worst-case scenarios for an individual and for a family, $6,850 and $13,700, and that's medical and drug combined. That's the most that you'll ever pay in all the copays for in-network services. Then primary care, the copay goes up from 10 to 20. Specialty care goes up from 10 to 25, and the emergency room goes up from 50 to 75. There is an additional new $250 copayment if you're admitted to a hospital, and brand name drugs are more expensive, and I believe mail order also went up a little bit. The Advantage Plus plan, this is a plan that is an HSA qualified high deductible health plan. So this plan can be paired with a special savings account that is kind of like a personal relationship between you and the IRS. And you can pay for your medical expenses, like when you meet your deductible or that coinsurance, with income tax-free money. For this plan, Boeing pays you to take this plan. And for 2018, they'll pay you 75% of your deductible. And 2019 and onward, it's just 50% of your deductible. So for this plan in 2018, the deductible will be about $1,300. The deductible is actually the lowest allowed by law. So that will change with time. And the Congress decides what is the new HSA deductible. And the lowest allowed is what is going to be in this plan. But that'll change. It'll go up maybe $25 or $50 every single year. Maybe the family deductible will go up by $100 per year. The out-of-pocket maximum is also linked to that deductible and is 2 times the deductible. And there is a non-network out-of-pocket max that is 3 times the deductible. So contributions, deductibles, out-of-pocket maxes are all linked together and increase together with the federal minimums. The coinsurance is 10%, so after deductible, it works very much like the traditional medical plan. The out-of-pocket max for a family, though, is a little bit less. This also, out-of-pocket max includes deductible. So for a family, it's at $2,600 in deductible, and then an additional $2,600 in out-of-pocket max. The Boeing has a pretty special approach to healthcare, and there's a new thing called a preferred partnership. Highly simplified, you can have quicker access to primary care, more after-hours care availability, dedicated teams for complex medical situations, and it is actually an option for it's an option for the in-network for the self-funded medical plan. So Advantage Plus, Traditional, and Select Network. You can choose to have just the normal old network. So for Traditional, for example, and Advantage Plus, it's the nationwide Blue Cross Blue Shield PPO network. You can see lots of providers all across the nation. If you're not going to be traveling very much, or if you're happy with seeing providers in the Puget Sound, you can choose the preferred partnership option. And if you do, then you would choose Swedish Prov system or the UW system. And you think UW, University of Washington, only downtown Seattle. But there are providers all over the Puget Sound. In this example, or this is from the website that I'll share next, the Prov Swedish is blue, all the way from Olympia to Cle Elum to Stanwood, and plenty downtown, but mainly on the north end of I-90. And then UW is in the red. They have a much larger presence south end in Tacoma. You can go to healthpartnershipoptions.com and find out more information. How this benefits you is if you enroll in this plan, Boeing will reduce your premiums by $30 a month if you're covering yourself, $60 if you're covering yourself and a spouse or yourself and a child, and $90 if you're covering a full family for traditional medical plan or select network. If you're enrolled in the high deductible HSA qualified plan, the Advantage Plus plan, Boeing will increase how much they give you into your HSA, your health savings account. For 2018, they'll give you 100% of your deductible, applicable deductible. So that means for a family, they can give you up to $2,600 in that deductible. Of course, we don't know what the Congress is going to do in 2018 with the deductible. But 2019 and thereafter, they'll give you 80% of your deductible for through the duration of this contract. The benefits are also better if you choose these plans. For primary care visits, for traditional medical plan and select network, you don't pay a dime. It's 100% free. And for generic drugs for traditional and select network, it's free. You don't pay for generic drugs or primary care. If you're enrolled in the Advantage Plus plan, there are some federal requirements that you have to meet that deductible first. But after you've met your deductible, you don't pay 10%. There's no coinsurance requirement for primary care or generic drugs. And as I mentioned before, there are some enhanced services. There are other voluntary benefit programs such as Carina, which is a web-based provider visit. If you were to cut yourself on your finger and you weren't sure if you had to go in, you could open up a chat session with a nurse and show the nurse with your webcam your cut finger, and the nurse can say, yes, you better get to the emergency room, or no, you can just put some duct tape on that. There's also home visits available. So if you are maybe working from home because the kids are all sick and you've got triplets and they all have the chicken pox, and if you cut your hand open, you can't take 3 kids with chicken pox to the emergency room. You can have a physician come out to your house and stitch you up. That's in limited areas, but very convenient where that's possible. There are also centers of excellence, and these are for special conditions, typically, ones that happen quite often, like heart disease, heart attacks, heart surgery, back surgery, knee and hip replacements. And if you have to travel more than 75 miles, there's travel assistance, and the plan covers 100% of those costs after deductible again on the Advantage Plus plan. Here are the rates. These are rough estimates, but reasonable estimates, and I believe they match Boeing's. So on the traditional medical plan, nothing is changing for the next 2 years. So all of 16 and all of 17 stays the same. But in 2018, the 5% should be about $30 to $31 a month, times 1, 2, or 3, and increasing with medical inflation. So if I were to cover myself in 2018 on traditional, I'd pay $31 a month. If I was covering Select Network, I'd pay about $79 a month. And the Advantage Plus is the HSA contribution divided by 12, which is how it actually works in 2016 and 17. They give you the HSA contribution pro rata throughout the year. But starting in 2018, the HSA contribution, if you enroll in that plan, will be deposited lump sum into your HSA, I believe the first paycheck of the year. And this is for the non-preferred partnership. If I were to enroll in the preferred partnership, it'd be minus $30 a month for myself, minus $60 for myself and a spouse or myself and a child, and minus $90 for a full family. So again, if I were enrolling myself in traditional, that would cost $1. $1 a month for the preferred partnership for traditional for an employee. Divided by 2 and taken out of the first 2 paychecks of the month makes it 50 cents a paycheck for employee-only coverage on traditional in 2018. So pretty reasonable premiums. And the Advantage Plus, the contributions into your HSA really do make it worth considering now. I mean, giving you, for a family, for example, giving you $233 a month in 2018, or giving you $200 a month thereafter, is significantly more than is in the plan right now. Significantly more, and it does make it worth considering. So health risk assessments. Remember we talked about Boeing being self-funded and paying claims with cash. Boeing has a financial interest in keeping you healthy. And this offer includes penalties for not performing the services that are required. So for an employee, you have to have your biometric screenings, and you can do that, I think, at least one of 3 ways. You can go to your doctor and have your doctor fax in a form that says what your cholesterol is and your blood pressure and your BMI, or you can have the assessments done on site when the nurses are there, or you can go to a website and type in your own information. For yourself and your spouse, you would have to complete a health risk assessment. Something like, do you wear your seatbelts when you drive? How much alcohol do you drink? Do you smoke? How much do you exercise? These are all intended to make you understand what your health concerns are. And they may have someone call you if you smoke to see if you want to think about non-smoking. But there is no smoking penalty on this offer. So if you do smoke, there's no additional fees that you pay for smoking or failing to enter a smoking cessation program. But if you do not complete, you, the employee, don't do the screening and the health assessment, or if your spouse doesn't do the health assessment and is enrolled in the plan, there will be a $20 penalty for you and an additional $20 penalty for your spouse for non-compliance. And a lot of the complaints we hear about this plan are that they're concerned about the privacy of their information. So this is actually inserted into your contract. The health assessment data will be collected by an independent third party. It just says third party. And the data will remain subject to HIPAA privacy laws at all times. Boeing employees will not see your individual results. So no Boeing employee knows if any other Boeing employee or SPEEA represented employee has high cholesterol, for example. However, Boeing does have to receive some information back to know who to charge $20 and $40. And they will get aggregate information back that says something like, half of the SPEEA techs have high cholesterol, or 30% of the engineers don't wear their seatbelts. I doubt that's true, but that's just a generalization. Now, regarding the Cadillac tax, there's also a lot of fear about this. I don't know if you know, the Cadillac tax got extended until 2020, but the point that you should take home from this is that SPEEA represented people will not pay the Cadillac tax, period. It doesn't make any sense for us to pay a 40% excise tax on the amount above the high cost claim threshold. But Boeing shouldn't either. That would be a complete waste of money for either you or Boeing to pay the Cadillac tax. So annually, SPEEA and Boeing will review the medical plans, and if any of the plans are expected to hit that excise tax threshold, we'll allow the benefits to be reduced on that plan to avoid the tax. And you think to yourself, that isn't very fair. Well, we're also going to reduce the premiums on that plan, equal to the value of the benefit reduction. So for example, worst case scenario, traditional looks like it's going to hit the Cadillac tax. So maybe the deductible goes from $300 to $325, and the value of that $25 increased deductible can be translated through actuarial figures down to, $5 a month or $10 a month. And so that premium will be reduced by that much. And if Boeing's actuaries and SPEEA actuaries don't agree, it goes to an independent third party to make a decision. So, but high level, you will not pay the Cadillac tax. This is a distribution of claims, so that you realize not everyone. I know when you think of the high deductibles and you think of out-of-pocket maximums, your brain naturally goes to worst case scenario. But the worst case scenario rarely applies. This is a distribution of claims for the SPEEA represented engineers and techs for 2014, and it's grouped by employee. So there were, for example, on the first row, 1,155 employees whose family claims for the whole year were less than $250. That's 5% of you. If you go the next row down, the 6% were in between 250 and 500, but when you total it, 11% of the whole group had claims less than $500. If you were to think about that HSA plan and that high deductible and $2,600 in 2018, that's the right page. 2018, 9,284 SPEEA represented profs and techs had claims allowed for their whole family less than $2,600. That's 40% of you had claims less than $2,600. So if in 2018 you had the exact same claims you had in 2014, 40% of you might want to think about that HSA plan. And the point of this slide is to really kind of open your eyes that it's not going to be an easy decision just to choose traditional anymore. There are 3 plans that are very different now. You've got a copay type plan that you pay more for out of your paycheck, the Select Network. There is the traditional medical plan that has a smaller deductible and coinsurance. And then there's a large deductible and coinsurance that Boeing will pay you money to take. And it really is worth your while to consider. And there are going to be pros and cons that are different than they are now for each of the different plans. Next and lastly is a long-term disability. Today, the programs are voluntary, and you enroll during open enrollment, or hopefully you enrolled when you were a brand new hire, but a lot of folks didn't. Approximately 2/3 of SPEEA is covered right now, and it's very, very important coverage to have. If you were disabled and you did not have disability coverage, you could lose your house very easily. The premiums are paid by SPEEA employees. It's about $30 a month on average, and the benefit is 60% of your pre-disability earnings. Because you pay the premiums, it is income tax free, and there's a 20% minimum. In this offer, all employees are covered. Boeing pays the premiums. That'll save you about $30 a month. If you need the benefit, though, it is a 50% benefit instead of a 60% benefit. And because Boeing pays the premiums, any benefit that you get would be taxable as income. There is, however, a 10% optional buy-up plan that you would pay, and because you would pay that benefit, any benefit on that 10% buy-up would be income tax-free. And there's going to be an open enrollment for everyone to choose that buy-up if you want in the fall of 2017 for a January 1 of 2018 effective date. It's kind of reasonable to expect, since the benefit is 10%, and today the benefit is 60%. Today you're paying $30. Going forward, it'd be about 1/6 of $30, or about $5 a month. So if you were to do this, it would be about a $25 a month savings, which is, I don't know, maybe about half of your union dues at that time. There is, however, a pre-existing conditions clause, a 3-month look back, and a 12-month pre-existing. So if you saw a doctor or should have seen a doctor 3 months before 2018, the plan wouldn't cover any new disabilities that began because of that same condition for the whole calendar year of 2018. Thankfully, though, any coverage by Boeing will satisfy that 12-month period. So if you currently have disability coverage, then there's no pre-existing conditions clause. But if you don't have it because you just forgot to enroll when you were hired, or maybe you're sick right now and have a bad back and a heart condition, you'll still get new disability coverage, but they won't cover any new disabilities for your existing conditions for the first 12 months. 13 and 14 months into it, no problem.